Assalamu alaikum. Today I will discuss the cervicofacial necrotizing fasciitis. Necrotizing fasciitis generally is very serious bacterial infection of soft tissue and fascia due to bacterial multiply and release of toxin and enzyme that result in thrombosis in blood vessels and lead to necrosis of soft tissue and fascia. Cervicofacial necrotizing fasciitis is rare life-threatening infection in the head and neck region that characteristically separate along the facial plane to the involved subcutaneous tissue, fascia, and fat. In late stage, it can involve muscle and skin. Like in this picture, have severe necrosis in neck and head region, involved also the muscles and external superficials. Inadequate treatment or neglect of odontogenic infection have serious consequence and potential of separate through the facial plane and intracranial can cause compromise of airway and cavernous sinus thrombosis respectively. On rare occasion, this can lead to rapidly prognosis and necrotizing fasciitis with destruction of soft tissue, making reconstruction very difficult. In this case, antibiotic administration inadequate without removal of the cause and also can complicate the management of the case. This picture shows radiographic appearance of caries lower left 6 in child as causative factor in necrotizing fasciitis and clinical appearance after debridement of necrotizing tissue and this picture after flap after reconstruction 3 week post-operatively. The main type of necrotizing fasciitis are type 1 polymicrobial like more than one bacteria involved, type 2 due to hemolytic group A streptococcus and staphylococci including methicillin resistant strain and referred to as flesh-eating disease. It affects all age groups and healthy people are also prone to infect with this group. Type 3 gas gangrene due to Clostridium perfringens. Other organism, marine organism like the vibrous species Leeromonas hybrophilia considered type 3 in some reports, and fungal infection by Candida and zygomycetes considered type 4 in some reports. These pictures show severe necrotizing fasciitis in upper extremity. In some cases it leads to يعني تسوي better in يعني العلاج مالتها يعني نضطر إنه نشيل الهاند or How do people get necrotizing fasciitis? Necrotizing fasciitis occur in anyone with almost half of all known cases of streptococcal necrotizing fasciitis occur in young and previously healthy individuals. May be associated with chronic disease and illness and usually found in alcoholic, diabetic, on insect bites or post-surgery infection or trauma. The disease may occur if the right side of a condition is present, like include the opening of skin, allow bacteria to enter the body, may occur following minor injury, like small cut, graze, or pinprick or injection, or due to large wounds due trauma or surgery, like laparoscopy and sclerotherapy and endoscopic gastrostomy or thoracectomy or Caesarean section or hysterectomy. Sometimes no point of entry can be found. Pictures show point of entry of bacteria due to pinprick or trauma or small injury. cervicofacial necrotizing fasciitis follow mandibular fracture or dental infection in some cases. Necrotizing fasciitis more commonly seen in extremity or trunk or perineum. But in head and neck region, it is very rare, 5.3%. But when it is occurred, dental infection is frequently the cause and the source of facial cervicofacial necrotizing fasciitis, either dental, sinusoidal, or peritonsillar or salivary gland infection. Infections secondary to the surgery or trauma have also been reported. Pathophysiology of the disease, the infection starts in the superficial fascia, and the bacteria release enzyme on protein and cause necrosis of facial layer, and then horizontally separate of infection may be not clinically appear on the skin, hence the diagnosis may be delayed, and the infection then separates vertically up to the skin and deeply down into the deeper structure, and thrombosis occur in the artery and vein in this area involved, lead to ischemia and necrosis of the tissue. This disease is not contagious, but in infection part of the patient get in direct contact with the open wound or abrasion of another person, that will be contagious. This picture shows the separating of bacterial infection through the fascia horizontally and then to the skin and the deep structure and vein. Streptococci produce M proteins which initiate an inflammatory response with the release of numerous cytokines like interleukin 1 and interleukin 6 with human necrotizing factor alpha. Oxotoxin, which is destroy neutrophils, allowing bacterial growth and destroy tissue. Aerobic and anaerobic bacteria, so in the production of hydrogen, nitrogen, and hydrogen sulfide gas that destroy hyaluronic acid, enabling the separate of infection. تؤدينا إلى muscle involvement فيكون separate rapidly. This picture shows healthy skin and necrotizing fasciitis infected skin. Necrotizing fasciitis skin show ulceration of epidermis and involvement of gas between the tissue layers and dermis. Also show the thrombosis of the blood vessels. The clinical feature of necrotizing fasciitis are very signs and symptoms are vary between individual, but often some or all of the following are present. The symptoms appear usually within 24 hours of minor injury. The early symptoms are a red, warm or swallowing area in the skin that separates quickly, and severe pain in this area, and fever. Intense thirst develop as the body becomes dehydrated. Now, in this picture we can see redness and swallowing, and the patient fell in fever or pain and severe pain. Clinical feature after 3 to 4 days, the affected area start to swallowing and may show purplish rash. A large dark mark from the turning into the blister filled with dark fluid نتيجة البكتيريال برودكت من الهيدروجين سلفر gas. The wound starts to die and the area becomes blackened due to necrosis. الأديمة is common نتيجة الانفlammation. A fine crackling sensation under the skin is due to gas in this area and this tissue called the crepitus. Severe pain continue until the necrosis or the injury destroy the peripheral nerve. When the pain subsides, infection may not improve when antibodies are given. By about days 4 to 5, the patient is very ill and dangerously low blood pressure and high temperature. The infection has separated into bloodstream and the body goes to toxic shock. In this way, the patient becomes altered level of consciousness. Metastatic abscess may develop in liver, lung, spleen, brain, or epicardium, and rarely in the skin. In this picture, abscess formation and swallowing, purplish, and الفوتوغراف before right leg amputation يعني نضطر انه نسوي بتر للساق لحد البلفيك hemi pelvectomy of patient with gas gangrene. Right side is edematous and discolored, and crepitus is detected in the deep palpation. At this juncture, the patient is in shock. البيكتشر توضح لنا early stage تكون redness and swallowing in the injured site, and late stage become dye of tissue and necrosis and flash eating of the area. Blackened area due to necrosis and dye bacterial products of gas. Diagnosis of cervicofacial necrotizing fasciitis not easily due to its rarity and may sometimes present as common abscess at the early stage. Clinical should therefore have a high index of subsection with any patient presenting with a fast separating swallowing, which is erythematous with associated fever, palpation of the wound to check for crepitus, which may indicate subcutaneous blood product. It's also necessary. A deep-seated gut may not be clinically palpated. Diagnosis arrhythmia 100% or bullei formation نتيجة الغاز كون crepitus and skin necrosis 40% and bullei formation 15%. And for the diagnosis, the golden standard for diagnosis is surgical exploration and sighting of high suspicion. When a small incision can be made into the affected tissue and finger easily separated into the tissue along the facial plane. Finger sweep test is like in this picture, the skin layer after we do subcutaneous incision, skin incision. We enter the index finger between the subcutaneous fat and the fascia. The tissue becomes separated easily. A wound swab for culture and sensitivity test to confirm the microorganism. Our CT scan may slow facial thickening, edema, subcutaneous gas, and abscess formation. Now, figure one, it's CT scan with the presence of gas involve all cervical spaces. Carious teeth, a common source of infection in head and neck region. Serious complications have been reported from odontogenic separate infection, include airway compromise, cavernous sinus thrombosis, or even death and blindness. In this picture, we have a patient with right mandibular second molar and alveolar bolus, periodontitis. 15 years old treated with Cervicofacial necrotizing fasciitis involve the anterior lateral part of the neck, lead to cyanosis and necrosis in this area. Differential from cellulitis is associated with pain, swallowing, arrhythmia, and edema, which can be mistaken for cellulitis or RC, mistaken for cellulitis or erysipelas. Trepitus is common due to the presence of gas-forming organism. Unfortunately, the disease is often diagnosed late in that its course, resulting in high mortality. Therefore, high index of suspicion is obligatory. Diagram showing the infected lower molars lead to necrotizing fasciitis in cervical region, and infection separate to the lower to facial tissue and lead to necrosis in this area. The treatment for necrotizing fasciitis, always we initiate with excessive debridement and broad spectrum antibiotic، يعني نزيل الأنسجة المتضررة يعني necrotic tissue. After that we reconstruction with a flap, and early diagnosis and rapid aggressive debridement are key elements for reducing mortality and optimizing the cosmetic and functional outcome in patients with cervicofacial fasciitis. This picture of reconstruction with a flap in other region in the body after debridement tissue. Hyperbaric oxygen therapy in clear role may have some benefit and involve the intermittent inhalation of 100% oxygen in chamber pressurized above 1 atmosphere absolute. Benefit is based on assumption that raising tissue oxygen level will enhance wound healing ability due to anaerobic bacterial unacceptable to the oxygen. Most of complication can be prevented by timely intervention on appropriate antibiotic therapy, extraction of the off-ending teeth, and incision and drainage of any collection. Picture show A. We can see patient with arrhythmia and swallowing of left side of the face and necrosis of eyelid skin, and C. We can see cicatrical ectropy and after successful debridement, and figure D after 6 months after reconstruction with the forehead flap to the upper lid and full thickness periauricular skin graft to the lower lid. Another case with cervicofacial necrotizing fasciitis treated by tissue debridement and tissue grafts. After that النتيجة بعد after the post operative treatment. Thank you.